Hello and welcome to this tutorial. I'm Greg McGarrell from Uppsala and I'm joined today by Mark White in the US, and we're going to be discussing a new use for the polyacrylamide hydrogel, and this product is called BMictamid. It's available in the United States. Point to note that this product is not available outside the United States, but you can look at the overall use of polyacrylamides and consider the use of polyacrylamides that are available wherever you are in the world and what product is available through Uppsala, so you can use it in a similar way. But for today's presentation, Mark's going to be taking you through how BMictamid was brought onto the US market for the use of it in urinary conditions in the equine mare. Thank you, Mark. Over to you.
Thank you, Greg. Polyacrylamides, one of the main uses in humans is for urethral bulking for women suffering from urinary incontinence. So in horses, we see similar problems. So urine pooling is a common problem that we see in reproduction of mares. So Greg, are you familiar with urine pooling?
No, I know that this product has been used in the human situation where women who have got urinary incontinence, especially after childbirth. And I know it's used in urethral bulking, where it's injected into the urethra to basically constrict it. But that's a urinary problem in women. I'm not too familiar with urine pooling in mares, to be honest. How is this different? What's going on with urine pooling? Explain that to me, Mark.
So urine pooling is when urine accumulates in the anterior portion of the vagina. So,
right, and that's a problem with breeding.
It's a problem with breeding when the mares are in estrus because the cervix is dilated. The urine can act as a wick, pulling bacteria and other particulates forward, contaminating the uterus and developing endometritis. So urine pooling is definitely a problem when it comes to breeding mares.
So the terminology urine pooling is exactly what it says. It's a pool of urine.
Correct.
And this is something that's more common in the aged mare. Yeah, you've got a picture here. So mares a little bit older in their cycle and their careers, then the whole sort of anatomy changes, and that's what creates this pooling, and that's what results in what they don't go to full pregnancy, or they abort. What happens? They don't conceive. What happens?
Once the mare is in foal, the cervix is closed, so it's not an issue then. The problem is actually getting the mare in foal. As they age, their conformation changes, their pelvis drops. So you can see from the reproductive anatomy, the bladder changes position to where it's dropped down. So when a mare voids her bladder, it can actually slough forward into the anterior part of the vagina and get into the cervix.
Okay, and how common is this?
For brood mares with a long reproductive history, it's fairly common. For young mares, not so much.
So if you've got a mare who is either starting to have problems conceiving, or you thought you're going to get this mare to become a brood mare and you never really get a foal out of her, or you have these problems conceiving, is it fair to say that this could have been one of the potential problems as to why she couldn't conceive?
That is definitely a possibility.
And the older the mare, the more likelihood that it's going to be a urine problem issue?
Correct. The older the mare, the more foals she's had, will all contribute to.
Right. So if she's had a foal, this could also develop afterwards. So she could have had one or two successful foals and then not get pregnant the following season. And again, this could be one of the issues. Correct. Okay.
So we can see from this slide here, one of the major causes of urine pooling is damage to the muscles on the bladder itself. That's caused from nerve damage, having multiple foals. Also decreased estrogen levels. We know this from humans and canine studies, that estrogen is directly responsible for the muscle fibers and contraction of the urethra.
Yeah.
So as we get older, our hormone levels decrease, which will contribute to lack of muscle tone in the urethra itself.
Right. Okay. So the idea then is to use the polyacrylamide hydrogel as a bulking agent so that tissue ingrowth occurs, thus necessitating or not necessitating the need to have that sort of muscle contraction that you would normally have with a younger animal.
With urethral bulking, we're providing polyacrylamide inside the submucosal of the urethra
Yeah.
and increasing coaptation. So we're just decreasing the space in the urethra, which allows for a tighter seal and prevents urine from backflowing.
Okay, so unlike the human, which is effectively a gravity issue, where we need to bulk that urethra to stop the urine literally leaking out. In the mare, obviously, it's slightly different. It's just to stop that urine leaking backwards or pooling into the urethra, isn't it?
Correct. So if the urethra doesn't completely close and the bladder gets full, they have no control. So we have leakage through the urethra, and it's very common when the animal is sleeping, relaxed, laying down. So gravity isn't going to be effective in pulling the urine down. That's why we have back seepage into the anterior portion of the vagina.
Okay. And how easy is this to diagnose? I mean, obviously going back to your repro veterinarian, this is something that they can look at and go, yes, she's a urine pooler.
So horses are intermittent, which is when they're in estrus or they're a constant urine pooler. So
Okay.
a lot of mares are actually suffering from this condition that we don't actually know of until we go to breed them and their cervix is dilated because the urine can flow back into the vagina as the mare changes position, move forward. So it's easiest to diagnose when the mare is in estrus and we're looking at breeding them. The only problem is that's when it's a problem because we have to clear out the urine in order for conception to take course.
Okay. All right. So where are we with this product? We know we've done some work, some studies. So what's happened to date so far, and where are we with the product in use?
So we are currently working on 2 studies, a safety study and an efficacy study. We injected 10 mares in the vestigial vaginal fold, which is located just above the urethra, to prove that the product was safe. There were no long-term reactions, no pain upon palpation. The product has been in place. This is a year-long study, so it's just counting days and continuing to monitor the 10 patients to prove safety. But so far, there hasn't been any.
When was that done?
So this was done in December of 2019, or October of 2019.
Okay, so we're about 4 months into it, and we've had no adverse reactions to this. I'd say if any of the viewers are looking at the other tutorials on the use of polyacrylamide, I think it's fair to say that polyacrylamide has been injected into thousands of horses for other conditions other than this repro issue, with a incredibly safe outcome. I mean, we've had less than 0.5% adverse reactions or sensitivity to this injection. So I think it's safe to say that we didn't expect any adverse reactions, but really it was just a case of injecting it into what would be regarded as sensitive tissue to see if it would get any reaction at all. And we haven't had any reaction to those 10 mares so far, have we?
No, there was a slight hematoma seen upon injection that went away after 3 days, which is just the common incorporation of a foreign material. Okay,
good. And the efficacy is obviously now moving forward to looking at those mares with the pathology. So it's been injected into the urethra this time. So not the same tissue that was injected into with the safety study, but this situation, obviously, there was no pathology in the safety one to inject into. One could, yes, inject into a healthy urethra, but that wasn't really going to demonstrate anything. But now we've gone that step further and deemed it safe enough to inject it into a mare that's, has the pathology and injected into the urethra in the same way as the human urethra is injected, correct?
Correct. So we're looking at 10 mares for this study, hope to be finished by July of this year.
Yeah.
So the procedure is very simple. It's injected into the submucosa of the urethra.
Yeah.
It takes about 6 to 8 minutes to do the entire procedure from start to finish.
Okay. And how much volume is injected?
3 to 4 mils.
Okay, not that much. Okay. It's considered to be a one-off application. They don't expect to go back in 3 months or 6 months.
Correct.
Yeah.
Correct. Yes, it's expected to be a one-time procedure. The product in human usage lasts for years. We expect the same results with mares.
Okay. And obviously the hospitals that you're working with at the moment, I mean, follow on aftercare, once these horses have had their injection, they're pretty much going back onto normal routine the following day. I mean, are they staying in overnight? Are they, any complications that they foresee? I don't see any reason to worry about these injections afterwards. I'd imagine if they're urinating adequately the following day, then that's a good indication. And again, you're checking for them to be dry or not urine pooling a few days after.
Correct.
Yeah.
So the mare can be turned out immediately as soon as she's awake from the sedation and after her first voiding. She should just be monitored for swelling and pain. She can resume her normal activities, but it's a very quick, easy procedure.
Very good. Okay. So moving forward then, so you're essentially looking for more patients to go on to the efficacy study, and then we're going to be rolling this out as a available product in the US. Is that correct?
That is correct. So we hope to have the product by next month.
Right. Okay, so if anybody's got any, depends when you're viewing this tutorial, if they've got any cases that they think would be ideal for this, they would really just give you a call. I mean, are your contact details anywhere, Mark? I mean, we'll put them on the information afterwards. Right, there you go, absolutely. So if we've got any cases that you think need to be put forward for the study or even afterwards getting a hold of the product, it's really just get a hold of you at this location. All right, well, Mark, that was a fairly swift little tutorial on the use of it. The other comment I'd make is on the Mictamid side, we've obviously taken or extrapolated how we can do this from human into equine. Is there any thoughts on doing a very similar procedure in canine in the future?
Yes, so several universities are doing urethral bulking with collagen here in the States. It's effective for a very short period of time, but yes, we look to roll this out on the canine market, hopefully before the end of next year.
So would you be interested to hear from small animal clinicians who see this type of case and they're interested in using this product under the sort of the guidelines that one would have on safety and efficacy to a potential rolling it out? So interested clinicians come forward is what you're asking.
Definitely.
Yeah. Okay. Good. Well, Mark, thank you very much for that very insightful tutorial on how to use polyacrylamide for mares that urine pool. Hopefully we see the product being used in another areas, but definitely this is a very interesting area to see the product being used alongside where it's used in orthopedic. So I'll be very interested to see how this develops.
Well, I think it's an excellent product and we're really looking forward to it. Thank you, Greg.
Thanks, Mark.